Arthroplasty. The patient underwent a total hip arthroplasty to relieve arthritis pain. Arthrectomy. An arthrectomy was performed to remove the damaged joint tissue causing chronic inflammation. Arthroscopy. The orthopedic surgeon used arthroscopy to inspect the torn cartilage in the knee. Gastralgia. She visited the emergency department because her gastralgia had become sharp and persistent. Tracheostomy. Tracheostomy, final answer. After the severe airway obstruction, a tracheostomy was replaced to help the patient breathe. Excuse me. Cardiomegaly. The chest x-ray revealed cardiomegaly, suggesting the patient's heart was enlarged from the long-term hypertension. Excuse me again, sorry. Rhinorrhea. The child's persistent rhinorrhea was most likely caused by a seasonal allergy. Cephalgia. He reported cephalgia that worsened with bright lights, indicating a possible migraine. Hemostasis. The surgeon achieved hemostasis before closing the incision to prevent excessive bleeding. Retinopathy. The ophthalmologist diagnosed diabetic retinopathy during the patient's routine exam. Arteriostenosis. The ultrasound showed significant arteriostenosis in the carotid artery, increasing the risk of stroke. Adenopathy. Adenopathy, final answer. The swollen lymph nodes were documented as cervical adenopathy during the exam. Arteriosclerosis. Arteriosclerosis was identified as the cause of reduced blood flow to the patient's legs. Hemolysis. The lab sample had to be redrawn because hemolysis occurred and interfered with the results. Osteotomy. An osteotomy was required to realign the patient's femur after the deformity was discovered. Carcinogenesis. Prolonged exposure to certain chemicals can increase the risk of carcinogenesis. Hematemesis. The patient presented with hematemesis prompted an urgent evaluation for gastrointestinal bleeding. Hemiplegia. Following the stroke, the patient developed right-sided hemiplegia and required physical therapy. Bronchoscopy. A bronchoscopy was ordered to remove a foreign object lodged in the patient's airways. Dysphagia. The speech therapist evaluated the patient's dysphagia to determine which foods were safe to swallow. Tachynia. The nurse noted tachynia and ordered the physician due to the patient's rapid breathing rate. Retroperitoneal. The CT scan revealed a retroperitoneal mass located behind the kidneys. Sigmoidoscopy. A sigmoidoscopy was performed to investigate the patient's rectal bleeding. Dyspepsia. The patient complained of chronic dyspepsia that worsened after eating heavy meals. Hepatomegaly, final answer. Physical examination revealed hepatomegaly, which was later confirmed by ultrasound. Pancreatoma. The biopsy confirmed that the mass in the pancreas was a pancreatoma. Esophagoscopy. No, it's esophagoscopy. Oh, I think it's not right. So, esophagoscopy. Final answer. The gastroenterologist performed an esophagoscopy to evaluate the patient's difficulty swallowing. Gastroenteritis. Several students were absent due to viral gastroenteritis causing vomiting and diarrhea. Rectocele. The pelvic exam showed a rectocele, explaining the patient's difficulty with bowel movements. Colopathy. Final answer. The patient's abdominal discomfort was attributed to colopathy, affecting the function of the colon. Thank you.